Jay, in your talk today, you talked about beauty being a part of healthcare delivery. Can you talk more about that and what that means?
Sure. To me, healthcare delivery is a process. And the process can be convoluted or it can be nice and simple. So we're designing a process that makes healthcare elegantly simple. So that involves the process design. It involves a nice, pretty sort of, color scheme. It involves a, crystal clear way of communicating exactly what we're doing. So to me, that's what healthcare sort of suffers from. I mean, it's pretty ugly in terms of the process, in terms of the branding, in terms of the way it communicates to the public.
So, can you give us an example of what ugly healthcare looks like versus what your philosophy is?
Yeah, sure. I'll give you an experience, a story about what recently happened in Sherpa. A gentleman reached out to us via email and described as classic appendicitis. So we forwarded the email to our general surgeon and sent him a text message. Dr. Goldstein sent him, he said send him right over. So we sent the gentleman over. Dr. Goldstein examined him, thought it was appendicitis, did a CAT scan. They sent him up a room. He laparoscopically removed this gentleman's appendix, and 3 hours later sent him home on oral antibiotics. So within the span of contacting us and being home minus an appendix was about 6 hours. That costs about $60,000 less than going through the ER and the traditional hospitals.
What's more effective, influencing or disrupting the system?
Healthcare, I think, is too big to disrupt. I would just much rather influence. I think it has a bigger impact, but it probably takes longer. But I don't know if disruption even exists at a really, important level when it comes to healthcare delivery in America. If you create a solution that works here in New Jersey, just 50 miles away in New York City, it's not going to work, right? So I think that's a real challenge in that I always look at the healthcare system as a series of disconnected barbershops that are all operating independently. And that to me is the best way to describe our healthcare system. Now that is, I've racked my brain to try to work within the healthcare system, but I figured that there are plenty of people in America that want something better and are willing to pay for something better, and I think that's the best way to go.